Speaking of COVID and vaccine, it is a big week on the vaccine front. The CDC Advisory Committee is set to discuss Pfizer's COVID vaccine for kids ages 5 to 11 tomorrow and Wednesday. And local vaccine providers are anticipating giving the age group the shots by the end of this week. WCNC Charlotte's Chloe Leshner is over at the Atrium Health in Dilworth. So, Chloe, how are the vaccine providers getting ready for this event?
Doctors say they're excited about getting this next age group vaccinated. Mecklenburg County health officials are expecting 13,500 doses of the pediatric Pfizer vaccine from the state, and they'll distribute that to all of the vaccine providers. And thousands of those doses have already been accounted for. There are 2 more regulatory hurdles to go, but doctors hope getting younger kids vaccinated will help put the pandemic farther behind us.
If we actually get a substantial portion of the children vaccinated, we're going to be able to move the needle in terms of herd immunity.
The latest data from Mecklenburg County shows kids 9 and younger made up nearly 14% of new COVID cases in the last 2 weeks. Kids 10 to 14 years old were almost 9%, and 15 to 17-year-olds were 5% of cases.
Younger children who tend to be asymptomatic, that's the other thing we're finding out, can easily spread the infection. So we need to have them immunized so they don't get sick, but also we need to have them immunized so they don't spread the infection.
StarMed has pre-booked more than 2,000 appointments, tentatively set to start on Thursday. But the Kaiser Family Foundation's latest poll found 35% of parents don't want to vaccinate their younger children.
So we certainly hope that as people see children getting vaccinated and being protected and being able to participate in activities without concern, that more and more people will get their kids vaccinated.
This comes as authorization of Moderna's vaccine for teens ages 12 to 17 is put on hold. The FDA needs more time to study the risks of myocarditis. Inflammation of the heart muscle has been reported for a small percentage of people receiving one of the 2 mRNA vaccines.
You can develop myocarditis after developing COVID as a complication, and that myocarditis from COVID actually is usually quite severe and makes people quite ill and causes a prolonged hospitalization. The myocarditis that we've been seeing after vaccine is generally fairly mild.
Atrium and Novant Health are not booking those appointments until final approval is given, but the Mecklenburg County Health Department has several family-friendly events planned for Saturday. They will go on regardless, but the hope is that 5 to 11-year-olds will be able to participate. In Charlotte, Chloe Leshner, WCNC Charlotte.
Chloe, thank you. The White House says the Biden administration is already assembling and shipping millions of doses for children. The CDC says the U.S. has enough vaccines for all 28 million children within that same age bracket. The first shots, they anticipate anyway, could go into arms by midweek.